Welcome back to Ahead of the Curve, the Scoliosis Experience. I'm your host, Dr. Megan Teed, and today we have an interview with Dr. Beth Terranova, owner of Strength and Spine. She is a fellow scolio warrior, a scoliosis specialist as well, and she is certified in the Schroth method and does strength and conditioning coaching for her clients. We're excited to have you. Welcome, Beth. How are you today?
Doing well. How are you?
Good. I'm good. We're just kind of winding down for the holidays, and this episode will be coming out in February, so you might be a little confused about that, but knocking out some episodes earlier on, getting ahead of things. So thanks again for, coming on this podcast today. You're a fellow scolio warrior, and I'd love to hear a little bit about your background, your Schooly story, how you're diagnosed, and things like that.
Absolutely. So I was diagnosed by my pediatrician at just like a regular checkup. I think it was, I remember it being before high school because we went to the orthopedist, and the orthopedist gave me a little note that said, Beth has scoliosis. She cannot carry textbooks, give her a second set of textbooks for home. So I remember I went into the library, and the librarian was a very sharp, curt woman. And I walked into the library. I had my soccer bag on one arm. I had my backpack on the other side. And she looked at me, she said, "You're playing sports. You're carrying all these bags, but you need a second set of textbooks? What that doesn't make any sense. Why? What? Huh?" Like, what is this scoliosis? Like, she didn't even know. I didn't even know what it was. Like, it wasn't even explained to me. Like, okay. So then that was the first time where I just kind of said, okay, maybe she's right. Like, it doesn't really stop me from anything. I guess who cares,
Mm-hmm.
And then around 15, I was told you're stopped growing. There's nothing really you can do at this point. And my curves were around, 30 degrees thoracic and like 20s something lumbar at the time. So, that was pretty much it. It was like, your treatment's over. I wasn't braced. I wasn't like a candidate for surgery, anything like that. The doctor's like, go ahead and do whatever you like. So I said, fine. So I was on the track team, and my track coach said to me, "Hey, Beth, we're going to start doing weightlifting because weightlifting is going to help with your track career." I said, okay, fine. I'm like the best student. I'm like, I'll do whatever you say to get better at track, because I'm about the slowest runner on the team. So he brought us down to our weightlifting gym. And it was actually the Olympic style of weightlifting. So if you ever watch the Olympics and you see what they do there, that was the type of lifting that I initially learned. And I started training and just built up, and never really thought anything about my curve. Ran it like, when I'm squatting, my hip always wants to go this way and I can't figure out why. Or when I'm pressing overhead, my coach is telling me, "Beth, stop rotating, stop facing." The barbell was always facing towards one side when everyone else could keep it straight.
Mm-hmm.
And it wasn't really until I became a physical therapist and I learned about Schroth method that all of that kind of made sense.
Mm-hmm.
And that was kind of like the culmination of my scoliosis story in a way, because I was like, all of these things that I noticed, all of these issues that I ran into were actually coming back to my curve.
Yeah.
And that was kind of what started the engine for me to learn more about it and kind of go on and take the next steps to really specialize with scoliosis.
Yeah. I'm curious, just from my own personal experience in PT school, what were some of the things that you learned about scoliosis? Like, did you learn accurate information about it, or like what sort of treatments did you learn? Because mine was pretty ridiculous.
So I learned we had two slides, I remember, in the thoracic spine lecture that was like, this is scoliosis. And then it was kind of like, well, it rotates right and it side bends right. And I remember my entire class being like, "Oh, it doesn't make any sense. I don't get it. How can it do that?" And then, of course, when we were to practice, everyone wanted to practice on me because I have the scoliosis. But actually, I was very lucky because the director of my PT program has scoliosis and was trained in Schroth method.
Oh,
And
wow.
he actually brought in my mentor, Hagit, who was also a graduate of my PT school, to give us a lecture on Schroth therapy. And I could have sat in that lecture and cried because she was just explaining everything, and little like light bulbs were going off in my head, like, oh, that's why that happens. Or, oh, that's why I noticed this. And from there, I knew I was like, okay, I want to learn more about this. I want to kind of take the next step to become certified
Mhm.
with this. So,
Yeah,
yeah.
it's really relieving when you hear somebody talking about things that like you've experienced your whole entire life and they're like putting all of the pieces of the puzzle together for you. Just, I understand that. So what led you to where you are now and doing the Schooly specific strength training?
Yeah. So I actually started my PT career in a hospital. And there was a new rotation to go to spine surgery. They had just opened a spine surgery ward, and I said, sounds kind of cool. So I went. Well, I didn't realize it was scoliosis reconstructive surgeries. They were doing fusions for scoliosis there. So when I got there, I was like, oh, cool. We're like looking at, and not, it was with Dr. Lanky. So the curves were like over 100-degree curves
Oh,
that he was
yeah.
operating on. So I started there. I started getting interested there. And then I moved to an outpatient facility and I trained in Schroth method around 2018. And I started doing Schroth, but my clients kept coming in. They're like, well, this is really great. I'm feeling really good, but I went to the gym. The personal trainer doesn't know what to do with me, or, the strength coach in school doesn't know what it means that I have scoliosis. I have to change my workouts. So I started integrating with my clients because I was seeing it work kind of in my lifting. I was still competing in lifting at the time. So I was integrating some of like the Schroth exercise with what I was doing in my training. And I said, okay, well, we started to do some Schroth, and then we started to integrate some of the weight training, and it was making sense. Like people were really catching on to it because then they could feel kind of how they were keeping their posture alignment and their correction against gravity.
Mhm.
So that kind of started there. And then during the pandemic, everything went online, and I said, well, maybe we can try making this an online program. And that's actually what we did. And kind of how the scoliosis strength program developed was that people had their workouts to do at home during the pandemic. And then beyond that, we just kind of kept it because it allowed us the opportunity to work with people anywhere that wanted to learn how to start strength training with scoliosis.
Yeah, that's incredible. Kind of circling back a little bit, can you tell us a little bit about your transition into the Olympic strength competitions and things like that?
Yeah, sure. So I started competing in weightlifting when I was 15.
Mhm.
That's when my track coach brought me down. He had already been competing. Basically they caught me and they said, if you had been in a country where they turn you into Olympian, you would have been made for this sport, because for weightlifting, it's advantageous to be short. So being that my scoliosis makes me shorter, it was good for me. And actually it's interesting. Scoliosis is actually advantageous for some of these strength sports, especially powerlifting. And we can talk a little bit about that later on, but I came down to the gym. I started training. I competed nationally as a junior, which is under 20, for a few years. So USA Weightlifting is like the governing body of weightlifting in the States. So I competed there. I competed for my college, up through national competitions as well as an adult. And then recently I did a little bit competing in powerlifting. It's a little bit different just because you participate different events than the weightlifting. And then I say that I quote retired from competing, at least for a little while. Other things came up, like starting my business and,
Mhm.
all of these things. So my strength training is a little bit more just focused in on general strengthening and not so much competing nowadays.
Yeah, I can imagine it's probably really demanding of your time. Like, how much were you having to train when you were competing?
Yeah. So there were periods of time where I would train twice a day, 5 days a week. I mean, that was kind of the schedule for some lifting. I mean, ultimately, probably at my best, I was training 3 or 4 days a week when I was competing at my highest level. I don't think you need to train that 5 days, twice a day. But that was kind of like oh, they're doing this in other countries, so we need to do that. But also in other countries, they're using maybe certain supplements, let's put in quotes, to help them. But anyway, yeah, so the training can be pretty intense. And honestly, I was lucky because the coaches I had, my first coach who got me started in the sport was like very attentive to form and really making sure I built up my strength, because I was like 99 pounds when I walked into that gym. I was like tiny little string bean.
Tiny.
Yeah. And my second coach that I had is actually also a physical therapist. So he was really cognizant of like my training to preserve and kind of keep an eye on my curve as I was progressing my lifts.
Mm-hmm.
But there were periods of time where I squatted double my body weight. I've deadlifted double my body weight. I've put, 1.5 times my body weight over my head. So, it probably, some people are listening to this like, but my doctor said, don't do that. But I'm telling you that I did, and my curve is fine. It hasn't progressed. So
You didn't fall apart.
exactly.
So kind of along that same line, a lot of people with scoliosis are told by their doctors that strength training will make their scoliosis worse. Why do you think that this has been something that's been perpetuated by doctors?
I think there's a few reasons. I think that there's this thought that lifting weights unloads the spine in an unsafe way. And I hear people tell this a lot, like, oh, if you lift weights, you're going to herniate your disc, you're going to injure your spine. And even in PT school, one of my PT school professors told me, you need to stop weightlifting. What are you doing? Your spine is just going to explode. Your discs are going to pancake. And in reality, that's not really how things work. Our spine is really made to be very stable, very strong. And our discs are meant to be shock absorbers and to accept loads and accept that shock. And even though they do get a little squished, of course, when we're putting pressure on them, they regain their height pretty much immediately after we stop lifting. And we see that in research, et cetera. So I think that's the first reason. I think the second reason is because there is a general misunderstanding of what strength training is. Some people think, they look at me and with my Olympic weightlifting and think, oh my gosh, I can't do that. Or like, I don't want my patients doing that, but not realizing that there's a spectrum of what you can do in the weight training world. That's not going to the Olympics and competing in weightlifting and putting, twice your body weight, 4 times your body weight over your head. Right. So I think that's a part of it too. And I think the last reason is because they've kind of gotten burned before by maybe their patient working with a trainer or coach or someone who doesn't really know scoliosis and is maybe incorporating exercises that are not the best for scoliosis. So I think then that person will come back and say, oh, well, I did this exercise. Now my back hurts. The trainer had me do this. And so I think that's kind of the reason why. I haven't found any, and I haven't found any research to say that lifting weights progresses scoliosis. There's nothing out there to say that. In fact, the only research that talks about lifting weights and scoliosis is a case study that someone wrote because they were told not to lift weights and by their doctor, and then they started lifting weights and felt better. So they wrote a case study of themselves, which was very interesting when I came across that. But so I think those are part of the reasons. I don't know if you've heard other reasons, but I think that may be why people get that recommendation to not lift weights.
Yeah, I think probably the last one that you said is the biggest. They've experienced their patients going to the gym, working with a trainer, somebody that doesn't understand scoliosis. And, I've talked to plenty of people too. They're like, yeah, every time I've tried to get stronger, like it just seems like I get injured. And it's because you're working either with yourself or with somebody that doesn't understand scoliosis at all. Um, so why is it important for people with scoliosis to strength train?
Well, I mean, I think the big thing, and we'll talk more about this, is bone density. We, even as scoliosis as teens, we tend to have lower bone density than the general population starting out, right? And we really build the majority of our bone density up until our 30s. And then we kind of plateau. And then once we go through menopause, now I'm talking about women, of course, but once we go through menopause, is then our bone density starts to decline. So if we tell our teens and adults with scoliosis not to weight train, I feel like we're setting them up for challenges down the line, because we're not giving them that opportunity to build their bone density and prepare for what comes later on in life. So of course, I think that's, for me, probably the biggest reason that I'm the most passionate about is that aspect of it. The second reason, I think, is because it's empowering to lift weights. And many of my clients, as soon as they get started, they said, well, I feel like I'm doing something for myself, and I feel like I'm able to do more. I remember one of my favorite stories of one of my clients is she had started working with us for a while and was in the playground with her son, and her son is about to jump off the playground and says, "Mommy, catch me." And she said in her mind is like, this is going to kill my back. I'm going to be in pain for weeks. Like, he's in the air and this is all going through. She's seeing like these flashes through her head, and she catches him and she said, my back did not hurt. She said, it felt fine. I felt strong. I think just to have that, and it is so empowering to be able to do those things day to day. Right. So I think that's one big reason. I think that also that working against weight helps us to learn a little bit more how to balance our alignment. And I think that's part of the reason why, even though I didn't have any scoliosis specific exercise as a kid, my curve was relatively balanced. And I think part of that was because I had to work against the weights to maintain my alignment.
Yeah.
And if I didn't, the weights would fall off the barbell, right? So I think there's an element of that as well. When you work with weights, it gives you that additional challenge. And then the last piece is, I think, relates into a little bit the empowerment, but is just to be able to be just resilient in your everyday life. Like I run into many people that say, well, I went to lift the laundry basket and nope, there went my back.
Yeah.
And if you're in the situation where your doctor's telling you, you can only don't lift more than 5 pounds, but you need to lift this laundry basket or the gallon of milk or your child, those things all weigh more than that. Right. So giving you the opportunity to be able to build your strength so that everything that's daily life becomes your warm up, right? Easy for you.
Yeah. Yeah. That's also important. So how does strength training actually help to build bone density and prevent osteoporosis? That's a big fear of all of the older adults that we work with. And I think it's so important to touch base and have them understand why they're doing what they're doing. So.
Yeah, big time. Resistance training has been one of the modalities that's been the most shown to not only preserve bone density, but in some cases to improve bone density. And I think that's very important because we are just, the natural progression after menopause with our change in our hormones is that we just start to lose bone density. And it can be, I think even as high as like 3 to 8% per year. Right.
Yeah.
So the way that resistance training works is it actually loads the bones in two ways. One is just the physical loading from the weight on the bones. And then the other is the muscle pulling on the bone. And those stresses kind of create the process of the bone to rebuild, because our bones are always in the seesaw of breaking down and building back up and breaking down and building back up. And we always want to put a little bit more pressure on that building up side of the seesaw, right? Because we don't want to have the breaking down be more the priority in a sense. So resistance training allows us to put that load through the bones. Now, how much load do we need to do? Because sometimes, I talk to people who said, oh yeah, I am resistance training. I got my 1 pound, I got my 2 pound weights and I do them, 100 times. No, you actually need to challenge yourself with the resistance a little bit, right? I think some of us get stuck in the same routine where we've been doing this routine for a while. Maybe it was given to us by our physical therapist or someone, and we're just kind of repeating the same routine for years and years and years. But what this research tells us is we actually need to put more intensity, more load as we progress, because otherwise our bones kind of stagnate and they just kind of stay, or potentially lose density. And my favorite study of this is the Lift More study, because they actually took women with osteoporosis and taught them to deadlift, squat, overhead press, and do jumping pull-ups. And if you think about, the average person who has osteoporosis, they wouldn't be going near any of those things, especially with a barbell. But they actually found that these women were able to improve their bone density in this strength training program because they were working with loads that were intense enough to push that progression for the bone to build. So I really think that I'm super passionate about this. This is one of the things that I talk about a lot, but weight training is just so important for building bone density in those ways.
Do you think that there's any age that's too advanced to begin this process of strength training? Like, is there anyone that, is 82 old to start strength training?
Never. No, there's never, you're never too late to get started. And we work with clients in our scoliosis strength program from our teens all the way up into 70s, 80s. And honestly, some of our ladies in the 70s are just, they're crushing it right now. It's like, I'm looking at their workout saying, could I do that workout? You're looking pretty strong there. But in reality, there's no time that's too late to start. And I know that many people may have reached a point with their scoliosis that they're dealing with pain, or maybe they're dealing with some progression and thinking, I can't do this. I can't. And that kind of goes back to what we spoke about before, is that there are different levels that you can come into with weight training, with strength training. And that might be as simple as working with resistance bands to start, or working on exercises you can do with your spine supported and pressing weights to get some work that way. So I don't believe that there's an age where you could not strength train. I think each person has an opportunity to, and they may just enter at a different level depending where they're at in their journey.
Mm-hmm. Yeah. I think some of my older clients that I work with are like the most inspiring, incredible people that I work with, because it's just like they come in and they ask me that question, like, am I too old to make any difference or any changes? And it's just so cool to see that happen, that transformation. So this is getting a little bit more into like the nitty gritty of things, but are there any lifts that someone with a scoliosis should be staying away from? So like if you have an upper structural curve, should you be staying away from overhead pressing or lat pull downs? Or what about like if somebody has a lumbar curve, are deadlifts like more of a cumbersome issue for them? Can you explain that a little bit?
Sure. It's a great question. And I'm going to give the answer that most people don't like to hear, which is it depends. I think it really kind of depends on the person and what their comfort level, what their curve is like, what their muscular support for their curve is like. So, I've always been comfortable to squat with a barbell on my back, to deadlift, to, pull weights that are heavier than my body weight, to put weight over my head. But that's individual me, like what I feel comfortable with. And I've met people that they are not comfortable putting a barbell on their back. They are not comfortable putting a weight over their head. And, I think that more comes down to what feels right for them and maybe, how their curve is and how that affects them as well. I don't know that there are any hard and fast rules for what you should and shouldn't do. And I think that, of course, one of the ways that we kind of look at, I think this is a better way to talk about it, is one of the ways that I look at, and in the strength training world, we look at working with a client with scoliosis is our form is not always going to be the textbook, right? Mm-hmm. Like if you open up the personal trainer textbook form and you look at a squat in the textbook, it's probably not going to look a lot like my squat, because my squat is going to have my pelvis maybe not exactly the most centered, and you're going to see a little bit my rib rotation. But for me, that's the squat form that I've adapted that works for me. And I've taken that form and progressed and strengthened through the years, maintaining whatever my best conscious posture is. So we create this difference between what is optimal and what is adaptable, right? And this is actually not my work. This comes from one of my colleagues, Rory, who is a powerlifting coach, but works with many people who have scoliosis. And she'd say, as you progress your weight training, you want to watch that your form is really staying the same, right? So if you have, let's say, a structural upper thoracic curve, and you notice as you're doing overhead pressing, as you're going to heavier weights, you're seeing more asymmetry or more lean or more one arm is going back further than the other, that may be an indication that, okay, you need to take a look at what you're doing and see, can you improve that as a form issue? Or is that something that's just built into your structure, right? So for example, when I was putting weights over my head with weightlifting, I was rotating, but that was not something that maybe I could really do too much about, because that came back to my curve structure. As many times as I tried to do strengthening on one arm to get it to go back, there was a limit to where I can go just because of my curve. In terms of lumbar curve to do deadlifts, Heather Connor, who was the world champion of powerlifting, has a scoliosis lumbar primary curve and deadlifted 4 times her body weight. Mm-hmm. So I can't say that deadlifting is bad for us. I mean, because and even other people like Lamar Gant is a very popular person in powerlifting world who I've seen reports of his curve being in the 70s, double curve, and deadlifted 5 times his body weight. So I think it's more a matter of you as a person, what you feel comfortable with, what feels like the right exercise for you, what feels like the right routine for you, and making the modifications that work for you for that long term, and realizing, okay, if you want to go compete, you can go compete. And I've worked with many people with scoliosis who compete in strength training sports, but also you can just do modifications if it doesn't feel the right thing for you. And that's totally fine. You can still make progress. You can still build. Like many of our clients who don't want a barbell back squat will hold dumbbells or do something in a different way that feels more comfortable to them. So I think that's there's not a specific, I don't know if you found anything different. Even when I've looked into the research, there's really nothing to tell us that you should or shouldn't do a certain type of thing with scoliosis. Even sports, they say play any sport that you like, just go for it, So
yeah, I think what you said is so important, that a lot of times with scoliosis, kind of our ownership of our bodies is taken away from us, and giving that back to that person, the ability to choose and say, yes, this is good for me, or no, that doesn't feel right for me. I think that that's, so tremendously important in the training program that you decide on, is like, is this right for me? So yeah, having somebody just tell you, oh, you can't deadlift because you have a lumbar curve, or you can't do this or that because of your curve type, is like so frustrating. So yeah. As a fellow Schooly and scoliosis specialist, what does you kind of touched on this a little bit already, but what does your current training program look like?
Yeah, it a little bit depends on the season I'm in or what I feel I want to work on. When I competed in weightlifting, powerlifting, we talked a little bit about that, like training 3 or 4 days a week and training with, barbell back squat, barbell bench press, barbell deadlift, the snatch and the clean and jerk from Olympic weightlifting, doing all of those type exercises. Nowadays, I say I lean a little bit more towards hypertrophy work, which is like just trying to build my muscular build and strength, and having that in more of like I train a little bit more like a bodybuilder now. So the bodybuilding is different because bodybuilders are looking more for the aesthetic than the strength side of things like weightlifters and powerlifters do. So I tend to train a little bit more on that side of things now. And I incorporate my scoliosis exercises, not as much as I should be. And that's actually one of my New Year's resolutions, is that I need to incorporate them more. But I incorporate them as part of the accessory to my strength training. So I use them in my warm up. I use them in my cool down. And we do this a lot with our clients too, because we feel that it really enforces like keeping your conscious posture and your alignment going into what you're doing with your routine. So as much as I can when I'm training, I'm paying attention to, how do I look in the mirror? Are my ribs centered over my pelvis? Is my pelvis shifting? And if I notice any compensations, I know, okay, I need to kick back the weight a little bit, or I need to adjust this exercise.
Yeah, that's great. So what does it look like for someone to work with you if they wanted to join the Strength and Spine program? How would they do that?
Yeah. So we have our scoliosis strength program is completely online program to help people with scoliosis and spinal fusions to start strength training. Basically, we start by just having a call to make sure it's a good fit. And then we get started in the program, which includes an assessment and some education, right? To have a really good understanding foundation of your individual curve and kind of how you want to position your body or pay attention to when you're strength training. And then we give our clients a customized workout program that they follow through our app, and help them kind of progress along the way. So it's really great. We find it's really fun. We get to see people do pretty amazing progress with their strength training, and we're just kind of rooting you on along the way. That's our big goal. It's like, you have to put in the work. We're just the coaches. I'm sure you're the same. It's like, I give you all the tools, but you have to put in the work. So
exactly.
Yeah.
Do you have anything that you're promoting right now? Any specials or anything like that? Or is it your online program kind of the main way to work?
Yeah. So that's one of our main ways. We also have we have courses. So we have a stretching with scoliosis course. So we made this because a lot of times that you go and people tell you, well, just stretch, or, start doing some stretches, then your scoliosis will feel better. So we actually curated like how to pick out which stretches are best for you, because oftentimes, some of the stretches are not really helpful for us. So there's a little program you can go through in that course to figure out the best stretching routine for you. And then recently we launched our core strengthening with scoliosis course. And this is a self-paced course to start learning how to strengthen your core with scoliosis, because that's another general recommendation that people get, is just go strengthen your core. So what does that mean? Like, what is the core even to start, right? And how with scoliosis do we need to maybe adjust some of our core strengthening, right? Because there's certain types of core strengthening exercises that might not be the best fit for us. So those are our main programs right now. We're hoping to, probably by the time this podcast comes out, we're hoping to launch an on-demand program with our own app. We'll see. We do have a tentative launch date, but we'll see when that's coming around. So stay tuned. You can follow us if you want to hear more about that. But those are our main options too, if you want to start strength training with scoliosis or with a spinal fusion too.
It's wonderful. If people want to follow you on Instagram, how can they find you?
So they can find us at Strength and Spine. We have our Instagram at Strength and Spine. We're launching YouTube next year at Strength and Spine. Probably around the time this podcast come out, and we'll have a few videos up there. And we have a Facebook group, the Scoliosis Strength Club. If you want to join, and in there we chat a little bit more about strength training with scoliosis, and you can find an accountability buddy in there to keep you accountable to doing your workouts.
Wonderful. So lots of tools for people, and I'm so grateful for this conversation that we were able to have today. Thanks for coming on, Beth.
Thank you for having me.
So you mentioned earlier that there are some advantages to having scoliosis with strength training. What are those advantages?
So it's interesting, actually, having a smaller trunk in comparison to the length of your legs is actually advantageous for weightlifting, because you don't have to lift the bar as high to be able to get underneath the bar, which is part of, with the Olympic style of weightlifting, basically what we do is we take the bar off the floor to overhead in one motion, and that's the snatch. And then we take the bar to our shoulders and then overhead from there. So if you have a smaller trunk, it makes it a little bit easier for you to get to that position. But actually the story that we use the most and that we see the most is actually in the deadlift. And this goes back to Lamar Gant, who I talk a little bit about, who was a power lifter with a severe scoliosis. And because his trunk was shorter because of his curve and his arms were longer in comparison, he had a much easier time to lift up the deadlift. And basically what he would do is he would lift up the weight and let himself just sink into his curve a little bit. And that actually allowed him to not have to pull the weight as far. Now, I wouldn't recommend that maybe as like something to try, initially, but I will say that, if you have scoliosis, you can actually have a little bit of advantage in some of the strength sports because of it. So it's interesting to think of it that way, that actually our scoliosis is a bit of an advantage.
Yeah, I love that.